Welcome to yet another edition of COVID-19. I'm Min San-hee. Lined up for this Wednesday on our ongoing case series is K-diplomacy in light of the global pandemic, as Seoul has pledged $50 million for a virtual global fundraising campaign aimed at creating a cure for or vaccine against the virus. But first, here are the headlines with our Kwon So-ah and Noaram. Welcome.
Hi.
Hi.
So let's start on the domestic front. We have marked an end, that is, the golden holiday, and people are back to work, and we're looking at eased social quarantine measures.
Right. I think it's a good day to actually shift into the new everyday quarantine measures because, as you said, the golden holiday is over and also the general elections are over as well. And on top of that, we have the lowest number of daily cases in around 2.5 months this Wednesday. So why don't we start with taking a look at our updates. Now, we have 2 new cases as of 12 a.m. and that is the first time in 78 days, bringing the total number of confirmed cases to 10,806. Another person died of the virus in the span of 24 hours, so the death toll now stands at 255, while more than 1,200 people are still isolated and more than 9,300 people have fully recovered. And let's take a look at daily cases since the beginning of this month. We do see here 2 we have today, and before that on May 1st we started off with 9 cases. Throughout the week we had single digits despite on May 3rd having 13 new cases. Those are the latest figures.
Now, along with those figures, I understand we're seeing less domestic transmissions of the virus.
Right. In fact, for the past 3 consecutive days, we had no domestic infections. All of these new infections were reported as imported cases. And as for the latest 2 cases, they were from the Middle East, with both patients being South Korean nationals. Now, but locally contracted cases can still occur, as has been mentioned at the earlier briefing at the Central Disaster and Safety Countermeasures Headquarters held by Vice Health Minister Kim Jong-un, and he stressed that the coming 2 weeks will be cautiously monitored as the golden holiday has just come to an end and the strict social distancing measures have been relaxed. Kim asked people who develop fever or respiratory symptoms after traveling to refrain from going out and call the KCDC call center or visit testing clinics before going to a hospital. The official cited health experts' warning of a resurgence in COVID-19 cases, adding the best way to prevent that from happening is following the government's new quarantine measures that do look simple but need thorough examination.
And we'll have more on that later on with our Aram. Meanwhile, on the global front, I understand the UK now accounts for the 2nd highest number of COVID-19 deaths in the world.
Yes, 2nd behind the US and 1st, the highest number in Europe. And that's according to the official figures, which reported 29,427 deaths as of Tuesday, surpassing the death toll of 29,315 in Italy on the same day. Now, at a daily COVID-19 briefing, UK's Foreign Secretary Dominic Raab called the situation a massive tragedy that the country has never seen before. However, he, as well as other experts, noted that before a comprehensive international standard on coronavirus-related fatalities is provided, it's difficult to compare the number of deaths to other countries. In the case of the UK and Italy, which now rank 2nd and 3rd when it comes to mortalities, both countries have similar standards when it comes to tallying their respective COVID-19 death tolls. Now, recently, the UK started to include people that died outside of hospitals, which is why, according to some data, the UK has already surpassed Italy in total deaths at an earlier date than Tuesday. Now, what's for certain is that Italy's cases are slowing down, with daily deaths in double digits, while the UK reported almost 700 deaths on Tuesday alone. Now, ranking the countries by their death toll can be seen as insignificant at this point, as some say, but But what we do see here through our daily update of cases in places with major outbreaks, that for many, it's not looking good at all, despite slower increases in some regions. We see the U.S.'s death toll now is at over 72,000, and we spoke about the UK's death toll at 29,427, and its total cases stand at 194,990, and followed by total cases in France and Germany, and Russia is following closely behind, as well as Brazil in South America. Now, going over to our world map, the virus is affecting 212 countries and territories with more than 3.7 million total cases, including at least 258,000 deaths that have been recorded worldwide. Now, the darker the red on the map, the higher the number of confirmed cases. That goes for the US and Europe being some severe places. And as of Tuesday, Africa has 47,000 cases in total, with more than 1,800 deaths. In Asia, almost 50,000 cases in India alone. Singapore and Indonesia have more than 10,000. And Central Asia is not as affected as other places, but Kazakhstan has now more than 4,200 cases and Uzbekistan more than 2,200 cases. And I believe we are going to talk about Uzbekistan later with an expert there.
Yes, I am. All right, so thank you for that. I'll get back to you after the briefing.
All right.
Right, Aram, today is the beginning of the government's eased social quarantine measures. What should we know?
Well, the government has outlined everyday health guidelines for what it's calling the new normal, or distancing and everyday life system, as they're calling it. Public areas that were closed due to the coronavirus pandemic will be allowed to gradually reopen as long as they abide by certain hygiene rules. Now, there are some key measures that still have to be adhered to. That is, staying at home for at least 3 or 4 days if you feel sick. Stay at least 2 arms length from one another. Sterilise surfaces, ventilate regularly, wash hands for at least 30 seconds and cough into your sleeve. Those are being called the 5 core instructions from the government. Now, movie theatres, concert halls and baseball and football stadiums are strongly recommended to space out their visitors at least 1 seat apart. Department stores are being advised not to offer makeup samples, and restaurants and coffee shops are being asked to encourage customers to order food and drink to go, to take out. Those travelling on public transport are being asked to sit 1 seat away from each other, and if you can register a seat in advance, then that is the way to do it. People who need to use financial services try to use online banking or ATMs rather than going to the bank in person.
Right. Aram, a drug used to treat Ebola is once again receiving attention as a strong candidate for COVID-19 treatment, but health authorities here are skeptical.
That's right. Kwon Jun-wook, the vice chair of Korea CDC, has again warned that we shouldn't get our hopes up too much regarding the drug remdesivir. The drug has been in the spotlight recently after its approval for emergency use by the US FDA and is said to cut recovery time by as much as 31%. Now, there have been promising results from the use of the drug on critically ill patients, but Kwon says more accurate and concrete clinical trials need to be done. He also stressed that it may not prove useful in widespread treatment in COVID-19 because it is more suited to these critical patients. And he also warned that it might not be as effective as flu treatment, for example. Kwon also noted that some experts have questioned the statistical significance of some of the purported fatality rates after using the drug as well. Now, the government is reviewing the possibility of importing remdesivir after full clinical testing is done. So it is still open to the possibility that it could be a treatment.
I see. On a brighter note then, Adam, Korea's baseball season kicked off yesterday and was aired in the US and Japan. I understand it was a bigger hit than expected.
That's right. US and Japanese media were active in reporting the start of the KBO regular season, and it was mostly praise. ESPN in the US and Sportzone in Japan have bought broadcasting rights, so they are available live in those countries, especially for competition-deprived Americans. Korean baseball was a breath of fresh air for them as the prominent MLB is still postponed. US media outlets including AP and the New York Times gave detailed reports on the opening matches. They noted that Korea has done a good job in containing the virus so far and therefore was able to be one of the first countries in the world, in fact, to kick off such sports leagues. And they also took note of the cautious nature of the games were played in. So, for example, they are being played behind closed doors and umpires are wearing masks, players aren't allowed to spit and so on. And some former MLB players are also explaining the similarities and differences between the MLB and KBO.
All right, Aram, thank you for that. We'll see you again tomorrow. We take you now to the regular afternoon briefing by the Central Disaster and Safety Countermeasure Headquarters on the COVID-19 situation here in Korea.
Let us now begin our regular briefing for the coronavirus outbreak here in South Korea. As of May 6th today, the total number of confirmed cases now stands at 10,806. This includes 1,104 imported cases from overseas. Of the total, 86.4% or 9,333 have been discharged following full recovery. And we also have a total of 1,218 people in quarantine undergoing treatment. Yesterday, we had 2 more patients. And these 2 confirmed cases were imported cases, and there were no community transmission. And all of these 2 cases were from Kuwait, and they have been reported positive at the airport quarantine. During the past 4 days, 6 people from Kuwait have been confirmed positive, and at the airport quarantine at the Incheon International Airport, we will be intensifying our quarantine for all of the entrants from Kuwait. And we are also advising the Korean expats there, and we are also giving them a warning of more intensified treatment and more protection against these infections. And we also see about 80% of the imported cases, which are related to imported cases, and we also see the imported cases accounting for a majority of the confirmed cases. And 5 of the recent cases, about 14%, were related to the cluster infections in nursing hospitals. And we also had some of the contacts with these already confirmed cases. And we are currently going through an investigation for 7 individual cases for the epidemiological investigation. And the KCDC stresses that we are transitioning into the social distancing in daily life, which is all about striking a balance between our ordinary daily lives and the quarantine measures. However, it's not going back to the pre-COVID-19 days. And if situations aggravate, we will be returning back to intensified distancing measures at any time. And we also highlight the importance of cooperation between the individuals and community as a whole. And most importantly, it's important to stay home for 3 to 4 days if you're sick. Keep a distance of 2 arms length between you and other people. Wash your hands for 30 seconds and ventilate your space at least twice a day. And individual quarantine measures, that is all about keeping physical space a distance apart. However, being close mentally is very important. We also have advised some of the healthy lifestyle habit guidelines for the elderly and the high-risk population. And also we need to highlight the importance of taking the regular drugs that these people with chronic illnesses have been taking. And if you feel sick, please get screened at the testing clinics. And if you go outside and if you go to, it is best to refrain from going to enclosed and crowded spaces. And it's also very important to keep in contact with your families and close friends. And if you have respiratory symptoms or fever, it is advisable to refrain from visiting the elderly people. And as for quarantine measures on a community level, the community needs to exert its best efforts as a whole, and it needs to come up with its tailored guidelines that fit that specific community, and it also needs to designate a manager who can oversee the entire quarantine measures, and all of the rest of the members of the community need to to comply with the 5 everyday infection prevention rules for everyone. Starting from today, we are transitioning into the social distancing in daily life. However, this is not about ending our social distancing measures. And if a situation aggravates at any time, we will be intensifying our measures going forward. The countermeasures headquarters, we will be monitoring closely the movement of people during the past golden holiday week, and we also advise people who have symptoms refraining from going to work, and please stay home at your home for 3 to 4 days. If symptoms aggravate, please call our call center at 1339 or visit the screening clinics. And if you have witnessed some of the symptoms among family members or your friends who went to the travels with you, we advise you to get screened as soon as possible. And very fortunately, we had 2 imported cases, and during the past 3 days, we had 0 community transmission. And this was possible thanks to the participation by the public and the dedication put forth by the medical staff. And that is why we have been successfully transitioning into the social distancing in daily life. However, it's important to remember that COVID-19 will not end soon, and this will be a global pandemic going forward. And the aim of the quarantine authorities here in South Korea, we will be monitoring the situations very closely, and our aim is to have a control over the COVID-19 spread through our medical systems and our society, and we will have close control and management of the system going forward. And until we would like to also highlight once again that this does not mean we could be letting our guards down as of yet, and also the COVID-19 can spread silently among people with no symptoms, and it also could lead very quickly to a widespread cluster infections. These are some of the warnings that we need to keep in mind. And in Europe or the US, they are going through a very intensive lockdown and immense economic fallout. And in order to prevent these from happening here in Korea, we will have to be responsible for our own quarantine measures. And ending the week-long holiday, we are going back to our daily lives. And please abide by the new normal that have been introduced by the government, and please participate in our efforts going forward. And the quarantine authorities, we will also monitor closely any outbreak trends that occur throughout the country.
Right, that was our Chung Kyung, the head of the Centers for Disease Control and Prevention here in Korea, with the latest status on the COVID-19 situation in this part of the world. I have Soa still with me in the studio to give us a summary of the key announcements.
All right, that was the afternoon briefing. And before we start with what she mentioned, what Chung Kyung, the chief of the KCDC, mentioned, I just wanted to say that beginning today, because we had that shift into the daily quarantine measures, beginning today, the briefing is not being, it can be attended by reporters again, because before they had to watch it online. So what we saw on the screen looked similar than before, and also what our viewers saw. But due to that transition into daily social distancing, now these briefings are also being attended by reporters on site, and they can ask questions on site as well. Now, what Chung mentioned today is that the 2 cases that we had, the new cases, were all imported from Kuwait. And it looks like there were 6 people who recently tested positive from that country. So quarantine measures will be enhanced for entrances from Kuwait as well as locally for the expats, South Korean expats there. And Chung also gave quarantine recommendations on this first day we transitioned into daily social distancing scheme, stressing it's not the end of social distancing, and measures can be intensified if the situation worsens anytime. So that is why the government will closely monitor the situation after this 6-day golden holiday that we had.
All right, so thank you for that. We'll see you again tomorrow.
Thank you.
The Republic of Uzbekistan had called on Korea for the presence of a Korean medical advisor in the Central Asian country to help establish an effective quarantine system there. Now, that advisor is currently Professor Yoon Seung-ju from Korea University College of Medicine, and I have him live on the line. Hello, Professor Yoon.
Hello.
Professor, perhaps we could start with a few words on your role there as a medical advisor.
Well, I have been working as a part of a team composed of ranking officers of the Ministry of Health. I work, eat, and sleep together in the same place with them. Ministry of Health seems to be doing their utmost to prevent further infection spread and managing infected patients. Professor Cho Jae-woo focused on preventing the spread of the infection. Well, my mission is to save one more critical patient life among patients who have already been confirmed to be infected by virus. Therefore, my job is one word, to help managing infected patients. Thus, I have been providing consultation to medical staff in remote areas through teleconferencing. My advice is reflected in critical care, which helps save the patient life in a remote area, because there is a lack of experienced doctors who major in critical care in countryside. In addition, I am giving my opinion through on-site visits to local hospitals to prepare secondary outbreak measures.
Professor Yoon, has there been any notable change or improvement in Uzbekistan's response to COVID-19 since your arrival?
I have been impressed and encouraged by the open-minded attitude of Uzbekistan people to learn from Korea's experience. Uzbekistan has accepted Korea's quarantine system. As a result, the daily number of confirmed COVID-19 cases, which reached 117 at some point in the past, is stabilizing down to 25 at the highest and 10 at the lowest these days. Well, statistically, at least 2% of patients die if infected with the virus. So far, there are 10 deaths among over 2,000 infected patients in Uzbekistan. There have been 2 new deaths in 2 days since I had arrived and participated in patient care. Local doctors who have achieved this result with me want to introduce Korea's intensive care system.
Professor Yoon, what has been the reaction in Uzbekistan to your presence and assistance?
First of all, I'm very grateful for Uzbekistan people's hospitality and warm reception of Korean medical experts. I had a series of interviews with local media, including pre-boarding interview in Seoul and interview on airport right after landing in Tashkent, which enabled me to feel the high level of attention to my activities here. Also, I heard that the local office of international organizations such as WHO, UNDP, have been paying attention to the contribution of medical experts to fight against COVID-19. They include our activities in their daily news bulletin. I have been told that the Uzbekistan government conveyed their gratitude to the Korean government at the highest level.
Professor Yoon, I understand that Uzbekistan is now allowing benefits to Korea given the latter's medical assistance. What are your thoughts on that?
Well, it is very hard to say. However, I have been aware that the Uzbekistan government made a special exception to operate special charter flights to and from Seoul, despite the fact that all flights have been suspended in Uzbekistan since March. I also saw media coverage that the Uzbekistan government made exemption for businessmen coming from Korea with medical certificates not to be subject to self-isolation and quarantine measures. A few Korean businessmen were on board the same flight as I was on the way to here. To my knowledge, they too were exception for self-isolation and quarantine measures upon arrival in Uzbekistan.
I see. All right, Professor Yoon, thank you very much for your dedication there, and thank you for making the time to talk to us, that is, today.
Thank you very much.
On May 4th, Irish Prime Minister Leo Varadkar made a phone call to President Moon Jae-in to inquire the South Korean leader about the possibility of sharing Korea's experience and know-how in containing COVID-19. Some 31 world leaders from 6 continents have requested South Korea's assistance in their efforts to bring the COVID-19 outbreak under control. In the process, President Moon Jae-in has emerged as a global leader in the fight against the COVID-19 pandemic.
It came from China. It should have been stopped.
Diplomatic tensions have also flared up between the major powers over the question of accountability regarding the COVID-19 pandemic, foreshadowing a major shake-up in the global balance of power. With South Korea having forged closer ties with other countries with the success of K-quarantine and shown capable leadership qualities in tackling the COVID-19 crisis, what changes are in store for South Korea's global standing in a post-pandemic world?
Among the changes brought on by COVID-19 are those related to the balance of diplomatic power after that is a post-pandemic world. Now, given Korea's rising global standing over its effective COVID containment, we focus our attention now on what role Korea can play in the diplomatic chess game once the dust, so to speak, settles on the pandemic. For more on this, I have Professor Chiu from Kyung-hee University. Welcome, Professor Chiu.
Thank you.
Chiu, that is. I'm so sorry.
No,
for
it's
that.
okay. It's okay.
And I also have Professor Hilda Valle from Hanguk University of Foreign Studies. Welcome, Professor Valle.
Thank you.
Professor Chiu, we'll start
Yes.
with you. China and the United States have been involved in a heated blame game. Just this past weekend, we had the U.S. Secretary of State Mike Pompeo claiming
Yes.
that there is enormous evidence to suggest that the virus was
Yes.
made in a lab near Wuhan. What are your thoughts on this?
I think it's obviously frustration coming out from not only the U.S. administration, but also the American public in general, because they don't know to date how this pandemic was originated, and China has not been responsive or open about open to the demand of information that could allow us to track down the causes and the origin of the pandemic. And I think this is where the frustration has mounted, and I think the Trump administration is leading the charge on behalf of the American public.
So it's a display of frustration.
Yes.
I see. What are your thoughts on this, Professor Valle? This blame game?
Oh, the blame game is part of this strategy of Trump to divert attention from the real crisis that he's facing, health crisis he's facing back home. And I think it feeds into his discourse of nationalism and sometimes even xenophobia. And I think this is all part of this divergent strategy, and especially in an election year in which he's going to face a lot of challenges, and his discourse that China should be blamed for fits really well into this strategy.
I see. Professor Chiu, I suppose such hostile exchanges between the US and China will
Yes.
also reflect negatively on their trade ties.
That's right. Yeah, unfortunately for the two countries, they were on the verge of signing the first round of the agreement, of this trade tariffs agreement. But because of the pandemic, everything was delayed, and because China exhibiting lack of responsibleness and openness and responsiveness to the world's demand of information regarding the pandemic, I think Trump is toying with the idea of putting pandemic tariffs on China in the foreseeable future, or once the pandemic is settled down. But I think there's also talk about building up an economic coalition that would exclude China when it comes to when the world economy recovers its global supply of chain. They would like to exclude China as a punitive measure. But world economy without China is unrealistic and unthinkable. But here, I think Korea has a significant role to play in.
Professor Valle, is there a way to resolve this animosity, do you think, in an amicable manner?
Well, it's difficult to predict what's really going to happen. Of course, it's the interest of everyone to have this resolved in the best manner as possible. We are learning that no one can fight this crisis alone. So, China and the U.S. in the past have cooperated in many fronts. I think during the SARS pandemic, this happened. And the U.S. depends a lot on China. Let's remember that the U.S. imports a lot of masks, needs a lot of chemicals from China to produce medicine. So I think they need to find a way to cooperate. Difficult as it is, cooperation is the key word.
Of course, this cooperation is very important also for Korea, I'm assuming, because for Korea, it's two great partners.
That's right.
What is Korea's stance, given this animosity between the two, the US and China?
Yes, I think it's going to be a very difficult challenge confronting the Korean government as of it is now, because politically speaking, we have to, join the U.S.-led coalition in pressing China so as to extract, some concrete evidences and information regarding how the pandemic was originated. But on the economic front, I think we can I think we have some leverage over the United States, and because Korea obviously is, just like it was reported, we have a really domestic transmission case of as low as 2 cases today. And I think we are on the verge of becoming an early bird out of this pandemic crisis. So, which means that our economy could recover much faster than others. And if our economy recovers at a normal scale and level, then I think we can lead the supply of chain and have leverage on the United States as to avoid all of these tentative and talking, more tariffs and punitive measures against China.
Professor Chiu,
Yes.
on a different note that
Yes.
is, what are your thoughts on the handling of the COVID-19 pandemic by member countries of the G20 and perhaps by the international entities like the WHO?
Yes, I think there are 2 separate cases. G20 has been really cooperative, very cooperative, and I think President Moon has done a good job in leading the charge of that, as was shown that he hosted a virtual conferences among the G20 leaders. And G20 leaders have been cooperative in sharing information and finding ways to overcome this pandemic crisis. But with WHO is a different case. WHO has been hush-hush about, about all these, controversies, there's so many controversies regarding, how it responded. As opposed to, G20, they have been really responsive in tackling the crisis, because as it has been the case with SARS and MERS and some other, pandemic crisis, although, including AIDS, just like, China has claimed, the United States and G20 members has been really responsive in the post-crisis manner. But whereas China and WHO, they have been lack of showing that kind of responses that G20 has shown, even in this case.
You just mentioned President Moon Jae-in proposing the G20 virtual summit in late March.
Yes.
Do you believe such efforts are on par with Korea's hopes to be a global player?
Yes. Just like this show is all about, K-Med.
K-diplomacy.
Yes, that's right. And it has been working really well. And I think with all our medical staff and medical technologies, overcoming this crisis, I think we have shown our merits and strength in this particular area. And I think that has been well respected and well accepted by the world. And I think we've been really generous and kind enough to share what we can spare to the world in overcoming this effort. Yeah.
Professor Valle, do you share these sentiments as well? Do you believe Korea is playing a greater, perhaps, diplomatic game because it's been so successful, that is, up till now, to contain the contagion?
Yes, absolutely. I mean, Korea is the model to emulate across the world, right? It has been the response of Korea, the 3T, right? Test, trace, and treat has been followed everywhere. I come from Brazil and Spain. In both countries, they are really following closely what Korea is doing. And I think it's very important to say that Korea is doing all of this in a very transparent way. right, with the support of the public and with respect of human rights. Often there is a talk that authoritarian regimes can respond better to crises like this. But what Korea is teaching us is that democracies can effectively respond to the crisis. So I think Korea will gain a lot of soft power. This will give a symbolic power to Korea to play, I think, a bigger role internationally.
And staying with that soft power, do you think that with that, will Korea have a better chance perhaps of facilitating a compromise between the US and China given their current tensions?
Yes, precisely. I mean, Korea really is a player that plays the multilateral card, right? And I think here Korea again will give a lot of will display its capacity, diplomatic capacity to facilitate a cooperation between two countries. And I think also it's very important that Korea is showing that being pro-America and pro-China is not a contradictory thing. So I think it's very important to emphasize this.
Right. Meanwhile, South Korea has played an outsized role in regional affairs, especially those related to its neighbor up north. Now, for more on the outstanding security challenges on the peninsula, I have David Maxwell, a senior fellow at the Foundation for Defenses of Democracies, a research institute based in the US. He's joining me live. Mr. Maxwell, hello.
Hello, good evening, or good morning, or good afternoon there.
It's good afternoon here. Mr. Maxwell, North Korean leader Kim Jong-un made a public appearance in almost 3 weeks, ending speculation about his well-being. Do you believe his reappearance helped ease the fear and uncertainty that had been building in the region?
Well, I think certainly fears have been lowered. It appears that the status quo is maintained, that the regime continues to function. But I think there's always uncertainty in North Korea. And what this episode really showed is that no one knows what is really happening. There were many rumors that were reported. But more importantly, no one knows what will happen if Kim Jong-un is incapacitated or, in fact, dies. And I think the fundamental question for South Korea, the U.S., for the South Korea-U.S. alliance is, if we learn that Kim Jong-un is dead today, what immediate actions would we take to reach out, to protect South Korea in the case of instability? Those are the questions that we really need to be ready to answer and really to take action when something happens inside North Korea. So uncertainty remains, but I think the situation has been calmed somewhat with his appearance, although his appearance is still questionable.
Mr. Maxwell, Kim reportedly visited a fertilizer factory to mark his first public appearance in 20 days. Is this perhaps an indication that economic efforts remain a priority for the North Korean leader? I mean, what message do you suppose was he seeking to send to his foreign audience?
That's a great question. I think certainly they need fertilizer to improve agriculture, and I think that's very important. But there are also reports that a factory like this is dual use. And both supports development of fertilizer for agriculture, but also supports the nuclear program, and that certain processes can be developed in this factory to support the nuclear program. So it is dual use. And so I think it really sends a double message that they want to improve their economy, but they are not giving up their nuclear program.
Mr. Maxwell, you just mentioned their nuclear program. Do you believe those issues have taken a back seat now, given the COVID-19 pandemic? And if that is the case, what can be done to bring these security matters back to the forefront?
Well, I don't think it's really on the back burner. The United States is willing to negotiate. President Trump has demonstrated his unconventional, experimental, top-down pen pal diplomacy. And negotiators from the United States are ready at a moment's notice. The onus is really on Kim Jong-un. Does he want to sincerely negotiate the denuclearization of North Korea? If so, and if he's willing to make the right strategic decision, the United States supports a brighter future for North Korea. But it is North Korea and Kim Jong-un that has to negotiate sincerely and have substantive negotiations that work towards the denuclearization of the North.
Okay, Mr. Maxwell, before you go, one final question. Could you share with us your thoughts on possible cross-border efforts, or perhaps those between North Korea and the US, to deal with a very much likely scenario for a COVID-19 outbreak up north?
Yes, despite the North's claims that there are no cases in North Korea, President Trump has reached out in his letter, said that we are willing to help. I don't think that North Korea will really accept direct help from the United States, but I would hope that they would accept help from South Korea. As you've discussed already today, South Korea is the world leader in how to deal with this pandemic. And I would think that South Korean help to North Korea would really be the best course of action. And the United States would support that, would support through South Korea or through other international organizations. But it is up to North Korea and Kim Jong-un to accept that help. And of course, the first thing they'll have to do is admit that they have a problem. And they've been reluctant to do so to this point.
All right, Mr. Maxwell, thank you for your thoughts and for making the time to be with us live today.
Thank you very much.
Professor Chiu,
Yes.
do you suppose North Korea and China have been sharing information in perhaps a secretive manner throughout this pandemic?
Maybe or maybe not. But my take is least likely. Because whenever there's a crisis or there's a case that North Korea has to manage in advance, then they would have a prior consultation with China, historically speaking. But when there's a sudden and abrupt crisis arises in North Korea, then I don't think there's a communication channel working between the two countries. I don't know if there's going to be discrete or secret line of communication between the two capitals, but historically speaking, especially regarding pandemics, we go back to SARS. There was no such cooperation or communication between the two countries. And also regarding his health issue, North Korean leaders and their families never resorted to China. They would either go to Russia or France or some other European countries for treatment, and they would never rely on Chinese medical staffs or Chinese assistance. So, case being that, I don't think it's very least
Little
likely.
chance
Yeah,
of that,
that's
I
right.
see.
Between the two countries, communicating, especially in prior manner.
Professor Valle, why is US President Donald Trump continuing to talk about his personal relationship with the North Korean leader despite the stall in nuclear talks?
Yes, Mr. Trump uses this as because of his lack of international foreign policy accomplishment. So this is his main foreign policy accomplishment. So he will use it and exploit as much as possible, right? And we need to be reminded that he was the very first sitting American president to visit North Korea, and this gives him a lot of importance in terms of American foreign policy. And so domestically, he will use this in his election campaign, that he can negotiate. And internationally, he has been withdrawing the U.S. Leadership position from Latin America, from the Middle East. So he can always use this as an asset. So he will hold on to this for a long time.
I see. Professor Chiu,
Yes.
compared to their partners in the West, countries here in the East have been relatively successful in
Yes.
containing COVID-19. Do you see this as leading to a shift in power, perhaps, to the East?
Yes, to a certain extent, definitely. Yeah, I think it's going to depend on how fast we can recover our economy. And with that being said, then how fast we can, contribute to the world economy's recovery. And if that's the case, then I think it could facilitate some power shift, especially on the economic front. But power shift does not happen in such way. So there could be a paradigm shift probably instead of power shift. So my take is it's going to all depend on how fast we can recover our economy first and how we can contribute to the world economy's recovery. And I think that if that's the case, then I think we are in good position to lead the paradigm shift, especially on the economic front.
Professor Valle, on a more somber note, do you see COVID-19, this current pandemic, further encouraging policies on isolation and protectionism? What are your thoughts?
Well, I think this crisis teaches us that we live in a very interdependent world, right? And I think I'm a bit optimistic about for the international cooperation. Yes, I think, as Professor Chiu said, there will be a paradigm shift, but I think still still countries will try to cooperate and find ways to do this. So I don't believe, Professor Chiu also talked about the G20 before. In the prior crisis, in 2008 economic crisis, there was not a surge of protectionism afterwards. And I think this will also happen. We had recently at the ministerial level a G20 meeting, and also they assured this attempt not to encourage protectionism.
Right. Professor Chiu, one final question. In a post-pandemic world, what role should Korea play and what diplomatic strategies should it employ?
Yes, I think just like I pointed out earlier, I think on the political front, I think we should join the world efforts in pressing China to share much more information and have them disclose much more information and make them available to the world, so that we can, come up with vaccines and so forth. On the economic front, definitely, I think we are in a good position. And if we can make a faster recovery than others, then we can also play an exemplary role of, contributing to the world economy recovery. And I think that'll put us in a great position and have leverage over the world economy affairs too.
Professor Vale, what are your thoughts about the role Korea should play and about the strategies, diplomatic or economic, that it could take?
I will insist again on the issue of Korea gaining a lot of soft power here. And Professor Chiu, I agree with him in all his strategies that he highlighted. I'd just like to add two more. I think Korea is in an important position to provide material assistance to developing countries. And Korea has done this in the past, and I think it would be very important here again. And also to us, Korea being a multilateral player, I think Korea should take the opportunity and strengthen the position of multilateral organizations such as the World Health Organization. So that's what I think Korea should do.
All right, Professor Vale and Professor Chiu, thank you very much for being with us today.
Thank you.
Thank you.
And on that note, we end today's coverage of COVID-19. We'll be back tomorrow at the same hour with details on K-medical industry as Korea marks a surge in the exports of healthcare supplies amid the global pandemic. In the meantime, do take the time to share your thoughts and inquiries with us through our social media accounts or our homepage arirang.com. Thank you for watching.